Hi everyone, this is just a quick video on A2 discharges. My name's Andrew. I'm one of the previous FY2s working in Antrim Area Hospital last winter past. I'm quickly just going to go through this quick set of presentations here. So first off, whenever you're actually trying to discharge any patients or even just logging in to do anything on Paediatrics, what you would need to do is once you've logged into Encompass, you'll be prompted by this page here. For department, you just want to put down the NT-AAH Paediatric Medicine. The reason being for that is that if you don't do this, you'll not get a tab that says Pediatric Navigators, which makes it really difficult to complete any sort of pediatric specific job whenever it comes to completing discharges and the likes of that. You won't be able to actually complete any of those without being in the right department. So once we've done that, then we'll move on to the main page. So this is just an example of a patient. You'll get a page that looks similar to this, and you can see that there's a part that says Pediatric Navigators just in the yellow tab at the top. Once you click onto that, then you'll get prompted with this page that looks like this. As you can see there's admission, IV fluid balance, transfer, discharge. For the purposes of this video, then we'll just look at the discharge portion of it. So regardless if you're in this tab or not, you also have this other part on the right hand side that says Cyber Summary Handover and Hospital Course. The hospital course, for the purpose of this video, is the important thing to be aware of. You'll get prompted with a tab that kind of looks like this. So you'll have your present and complaint, hospital problems, clinical course, relevant investigations, outpatient investigations, instructions for the GP, and follow-up plan. Obviously this hasn't been filled in for the purposes of this video, but essentially you'll just go through and work through this and just write a discharge letter according to what each title prompts. So a present and complaint, for example, might be a wheeze, cough, rash, anything that's specific to that patient. Then hospital problems is usually sort of limited to past medical history or other problems that have been complicated by the main present and complaints, so the likes of AKI or requirements of maintenance IV fluids, things like that. You would also just put in historical past medical history, so previous history of known asthma or anything like that, just anything that you think might be relevant. Clinical course then is just more or less just what has happened while they've been in hospital. So initially it might have presented on, say, for instance, the 1st of August 2025 with wheeze or cough, and this is what we did, and then they were discharged on whatever date that they were discharged on. Relevant investigations and results, you might put in radiological results, and just if they've been reported on, you might put in whatever has been reported on. So say if there's, like in particular, like if they've had an ultrasound, you might want to put in what the radiologist has put in as their report, or you might want to put in blood results if you think it might be relevant. Outpatient investigations then is just if the patient is requiring any sort of further investigations outside of this inpatient journey. So the likes of might be ultrasound or DMSA scan, whatever appears relevant. Instructions for GP then, so again, similar if a medication is only to last for a certain amount of weeks or a certain amount of period of time, and then for the GP to review that, then you might want to put instructions for the likes of that in that part. And then follow-up plan is, say for instance, a patient needs to be reassessed by a certain consultant in a certain time frame, you might want to put that there. Or if a other clinic might or specialty might be seeing this patient, you might want to put something into this part of the follow-up plan. So you'll quickly just update this part of the hospital course, and then whenever you're actually putting in the discharge, then you'll see on the highlighted part here in the purple is notes. If you click onto this, you'll be prompted with a page that looks like this on the right hand side. And for type, you just want to put down discharge summary, or if you type in 5, you'll just get the same prompt here, and then it'll be auto-filled with whatever you've put in the hospital course. So as you can see, we haven't written anything for this hospital course, but you get exactly what you've written in the hospital course that's prompted here. Also important to note, just the cosign required. If you click on that, then it'll give you a prompt to say which consultant this patient is under. It's just so that the consultant can then read this discharge letter and confirm that all the details are right, and if they need to follow up on any sort of other further plans, essentially. So for instance, say this patient was under Dr. Sayers, then you would type in Matthew Sayers as the co-signer, and hopefully you'll be able to see his name pop up in like a text box, and then you just double click on his name, and then whenever you sign this letter, it'll go to his inbox just for him to fully sign it off. But it should be, all the pediatric consultants should be available once you type in the cosigner. Important to note also, just in C2 in the postnatal ward, unless specifically requested to, all the co-signing would go to Dr. Ruth Humphreys. Just important note. But for A2, it's just usually whatever pediatric consultant is on. Okay. Whenever we're actually discharging patients, then you have to go into orders then, which is this red highlighted box. If you go into orders then on the right hand side, if you just type in discharge patient or discharge, you'll be prompted with an order that looks like this. More or less, you're always going to put down the discharge method as normal discharge unless you're prompted to do otherwise, but for the most part it's always going to be normal discharge. Discharge date and time doesn't really matter, but usually just type in date as today, or just if you click the box that says today. This order is purely just for nursing purposes, so it's just so the nurses can remove the patient from the actual patient list in the ward. It doesn't really necessarily mean that they're being discharged imminently or straight away. It just gives the nurses the ability to remove them from the patient list. So once you've done that order, then you want to make it back into pediatric navigators. And then on the left hand side, you can see that there's a part that says discharge orders, pretty small. It's around med check and insulin instructions. But if you click on discharge orders, then this prompts you into the page that looks like this. And the purposes of this page is basically being able to order medications or follow-up clinics or follow-up scans that need to be done once they're an outpatient. You can also be able to do the discharge patient order as mentioned previously in the other slide. Home medications are just any pre-admission medications that the patient has already been on. So you might find that an asthmatic patient might already be on salbutamol. You'll be prompted with a plus or a minus sign, which we'll see in the next slide. And essentially you're basically deciding whether this patient needs to stay on that medication or can be taken off that medication. Similarly with inpatient medications, then you'll have medications that have been started during this admission, and you'll get a plus or a cancel sign, and that basically decides whether that medication is to continue or to stop. So in terms of follow-up appointments, then you'll be prompted with a page that looks like this. You'll get, say for instance, one of the consultants wants to see this patient again in 3 months' time. So you'll get prompted with a box that looks like this. So if you type in follow-up, you'll get this order, this box here then. So you'll type in, or just click the box for future, and for, say for instance, in this case we're doing 3 months, you'll click this box. It's a fixed review, and then in clinic. And then following that, then you'll have between specialty, any location or clinic provider. For the purposes of this order, say we wanted Dr. Sayers, or Dr. Sayers says that he wants to see this patient again in 3 months' time. If you type in, or if you click the box for clinic provider, you'll be able to specifically write down Dr. Sayers and get his clinic. For the sake of a pediatric specialty, like say cardiology or renal or something like that, then you'll want to click on the specialty any location box and just fill in as appropriate. For priority then, depending on what the case is, but most of the time will be routine if it's just a routine follow-up appointment. Obviously if it's a urgent request, then you would just hit urgent. And again, it's all sort of self-explanatory if you just click the appropriate boxes. If you're finding that you're not able to find this a certain specialty or a specific consultant, playing about with the boxes, it usually does sort of eventually get you to the right place, but just ask anybody that's more familiar with the services on Encompass. But it's all usually fairly self-explanatory anyway. So that's in the case of requesting follow-up appointments, but say for the likes of medications then have been started while they're an inpatient. So say you have a 5-year-old that's been diagnosed as a asthmatic, and you're wanting to start salbutamol, so they're not previously taken salbutamol, so there's nothing in their home medications. But for the purposes of this, they're going home with salbutamol, then you'll have their order for salbutamol already in their inpatient medications, and you'll have this plus or cancel sign. If you hit the plus button, then that'll prompt you with a box that basically says how much of this medication you want to give for home and how long you want it to continue for. Depending on the purposes of the medication, you'll maybe just say continue as much as needed, essentially, or say it's a medication that you know that the patient no longer needs, so the likes of laxatives, then you'll hit the cancel button. Hopefully that makes a wee bit more sense. But it generally is all fairly self-explanatory and easy to use. It just takes a wee bit of practice and get used to, essentially. I'll just make sure that's everything. Yes. Obviously, if there's any concerns or if you're not understanding parts of the actual discharge process, there's plenty of staff that should be around that are a wee bit more familiar with the process of doing that. Like I say, it just takes a wee bit of practice and a bit more getting used to if you're not familiar with the service. But it is all relatively straightforward, and once you've done it a few times, it becomes second nature. Hopefully, that is a wee bit more information and easier to understand. Obviously, if there's any further questions, just ask around for any help, and I'm sure there's plenty of people will be around to help you. Okay, hopefully that's helpful. Thank you.